Okay, so super excited to talk about this next topic. Got Dr. Yeilding back in the house, and we are curious about fillers. So we talked about Botox already. If people want like to be rejuvenated with a fairly sort of not low cost, but a lower cost procedure, fillers are a really cool way to do this. And I love that you're sitting down with us and like showing us what's what here.
Yes, absolutely.
So yeah, what are they for?
Okay.
And where do we use them? Let's start there.
Okay. So the fillers that I use are all hyaluronic based fillers, meaning it's a sugar molecule natural to your body. They are what we call cross-linked in a different manner so that they have different thicknesses, and they have different times that they last.
Right, okay.
So different fillers are used in different areas.
Of the face.
Okay. Correct. So these are the main fillers that I use, and I'll just talk. So just so you know what a filler, what it looks like. They come in these syringes, right? So you purchase them by a syringe, but it's just, I'll show you. Actually, I'll squirt some out.
Oh my gosh, so it's a thicker consistency.
It's everyone's different. So this is actually velour, and you can see it's just a gel-like substance. It's clear. Okay.
How long does that last once injected in the face?
So velour actually lasts 1.5 years.
Wow, okay. In what area would you put that one in?
So velour, so there's 2 new ones that actually, there are 3 new ones that came out, and they actually are cross-linked in a different way, meaning there's less bruising, less swelling, and they last longer.
Okay.
Velour I love. I really, really love it for lips.
Oh, okay.
So it's fabulous for lips. So it creates I'm a very natural looking, I like natural faces and natural lips. I think you look your best self. You shouldn't look done. The people who look done have had bad injectables. Okay?
Right. Yeah, we want it to look like we didn't really try too hard.
Just a little goes a long way.
Okay.
And I always tell patients, come back. We'll do a little now, and we'll stack. So for lips. So lips, it could just give you, a lot of patients start to lose volume in their lips, so we stop seeing the lips, and they get wrinkled, or their lipstick starts to drain in, or patients just want a little bit of a fuller lip. So we do it very conservatively. Velour is great for it. It lasts 1.5 years.
Okay.
And different people need different amounts. So we don't necessarily use the whole syringe if they don't need it.
Right. Show us the needle, too, that you would use. I mean, this is, everybody hears an injectable in their lips, and they
so it's actually the same needle. So it's a 30-gauge needle, yeah.
So it's a thin
These are small needles.
And you numb beforehand.
So we use topical numbing, and we use ice. And patients tolerate, this is a pretty small needle.
Okay.
Juvederm is kind of its sister. So it's a little bit older and has been used for a long time. Velour I also really like for the nasolabial folds and the marionette lines. So if you look on you, these are nasolabial folds, and you don't have them, but they're called marionette lines when people have frown lines.
That's like the only wrinkle I have not earned yet.
Good job.
Give me another 5 years.
You look great.
I got a couple more.
You look great.
But Juvederm, we hear this name all the time.
Juvederm's a little bit thicker, so it's for someone who wants a little fuller lip, or they have really deep nasolabial folds or marionette lines.
Okay, and how long does this guy last?
This one lasts only 1 year.
Okay, so a little shorter.
It's a little bit older. It swells a little bit more and a slightly larger needle, but still very well tolerated.
Okay. It's been around for a reason, for a while.
Yeah, it was one of the earlier developments.
Okay.
This is fabulous filler. I love this filler because it looks great on almost everyone.
The Voluma,
It's called Voluma. Okay, so Voluma is primarily used for cheek augmentation. So there's a big misconception because people come in with these huge full cheeks because they've been injected in the wrong place. The idea where you want to inject cheeks is along the cheekbone. So it's more for contouring. So think about makeup and contouring to contour your cheeks. So as we age, we lose volume in our face and things start to drop. So it gives you a little bit of a lift.
So you would go right on top of the cheekbone with it.
Right. And so multiple little bitty injections. It doesn't hurt at all. I've actually done it to myself. So I've done all these things to myself. So inject along the cheekbone, and it just highlights the cheekbone and gives you a little bit of lift. So people with like long faces that are very narrow, or very thin women who exercise a lot, it works wonderful.
Wow.
And it's very natural looking. It doesn't hurt. I usually do 2 at least. 2 syringes per person, but if someone wants to start slow, we start with 1. So come back in 2 weeks and we'll add more.
That's kind of cool because you see like the immediate result
and
there
so
too.
With all of these fillers, unlike some of the other fillers, so I only use fully reversible fillers. Okay, so meaning there's an enzyme called hyaluronidase that goes in and actually breaks up the sugar molecules within 24 hours. If something were to happen, or to have a allergic reaction, or you didn't like something, so that's the beauty of it. in my opinion, in today's world, you should not be using non-reversible fillers in the face.
And does that have a similar staying power as far as a year to a year and a half? The Voluma?
Oh, no, this is the longest acting filler.
Is
2 years, baby.
Ooh, wow. Bang for your buck.
Yes.
I like it.
It's great.
Okay, what about the Volbella?
Okay,
I
so
see that.
Volbella is, it came out too recently. It's cross-linked similarly to Voluma, but it's a very thin filler. And I primarily use it for the lip lines, the vertical lip lines. Someone who wants a teeny amount in their lips, or for the nasal labia, for the tear trough.
Yeah.
So,
okay, that was another thing I wanted to ask, because people do have, we get these troughs underneath our eyes. Are those genetic?
Yes. So, and the key thing is knowing who's the right patient for under eyelid filler. So we probably have at least one person a week come in to have filler reverse underneath their eyelid because it's been injected incorrectly. If you have big bags underneath your eyes, you need surgery, and filler is not the answer because it's just going to make it more. It
just
full.
Adds more to that
and
space.
You don't want to put too much because you can see it through the skin a lot of times, and it looks terrible. It can swell up, and it can make your eyes look puffy. So you need just a little bit in the right place and the right patient. So it's not for everyone. It's for a select patient who has an indentation in this area that's called the tear trough, and you have to be very careful about using it correctly.
Yeah, because it's not I would imagine, not like a one solution fits all kind of deal, because you have people who have bags, you have people who have dark circles, you have people who have a combination of both. So you really customize each treatment.
Correctly. So since we do surgery and non-surgical things, I will counsel a patient, this is not meant for you. You need to have surgery. You're not going to be happy with just this. This is not the answer. And if you can't afford it now, then let's save up and do it when don't waste your money on this.
Right.
Let's save money and do the surgical procedure that will actually fix the problem that you're bothered by.
So what do people need to go in and ask their doctors if they think that injectables might be something they want to try?
It would be nice to go to someone who does both so they can offer both, so that they're not only, if you go to someone who only does fillers and they don't have the option to offer surgery, they can refer you to someone.
Right.
But the question would be, what should I expect? Do you have some before and after pictures?
Always ask to see those.
Right.
I feel like that's important.
And, what do I do if something that goes wrong? Are you going to fix it, etc.
Okay. But there's a lot of options. I feel like every time we turn around, there's something new hitting market.
There are, and they're just getting better and better and better. This is actually the new syringe that just came out, and it just works. It's so much more ergonomic and works very well. I love it. It came out in the last month, so I love that. And
I have to say, you have the doctor's eye, obviously. Are you looking around these days and noticing, does everybody do something these days?
No, not everyone does something. Because I have a lot of patients who come in here and they've never done one thing.
Wow, okay.
They might come in for a facelift consult and they've never done one thing their whole life.
Okay.
They might not even wear makeup. You'd be surprised. That was one thing I was surprised in my training. These facelift patients would come in and they're like, I don't wear makeup. And you're thinking, you're getting a facelift and you don't, but yes.
Yeah.
We teach them how to wear makeup and what to do.
Right.
And so it's just, it's interesting. Not everyone does something, but it is a good idea to do what you can. And you don't have to go, big and strong. You can start little and do little things at a time. And safety comes first.
Right.
So you want to be injecting in the right places and be safe. So there are risks to anything you do, and it's your face. So you want someone who really knows what they're doing, what the anatomy is, what to look for, etc.
We don't want to be getting it on Groupon, is what you're saying.
Right.
If possible.
Right. That's
not a knock on Groupon. I'm just saying you want to go to a specialized person who does faces.
Right. In a doctor's office, in a place that's safe, not at a party.
Okay, that was my next question, because they do seem to be offering a lot of these.
So, all sorts of things can happen with these products. You can get infections. You could get if you had a filler that was injected into a blood vessel or injected in the wrong location of the face, it could make you go blind.
Oh my goodness.
So people get filler in here, that could go into a blood vessel. So all sorts of things can happen, and if someone doesn't know facial anatomy and know what the potential risks are, which are extremely rare, but if they happen to you, they're not rare.
Oh yeah, sure.
So it's something not to be taken lightly.
Okay. Well, thank you for filling us in.
Yes, absolutely.